Haresh Mehta, consultant cardiologist and director of cardiology at 𝐶 Fortis Hospital. I want to recount my story about my spine condition. I developed back pain when I was very young. I was in my late 20s or early 30s, and I had back issues where my back used to pain and the pain used to radiate down both the lower limbs. And of course, I was extremely overweight, and since I was a cardiologist, we were used to standing, bending, turning without noticing what's happening, and we used to wear lead coats which were heavy to reduce the risk of radiation. All this contributed to this. I met Dr. 𝐁𝐽𝐻 sir, who was our senior in 𝐾𝐫 Hospital when we were studying. We had seen him do a lot of spine work at the 𝐾𝐫 Hospital, so I consulted him when he was a consultant spine surgeon at the Hinduja Hospital, Mahim. He advised me that since you're very young, why not try conservative means? So we got into physiotherapy, weight loss, and after that I was okay for a few years. I went abroad, finished my fellowship, and came back and joined the same hospital as Dr. 𝐁𝐽𝐻 as a consultant. Subsequently, the exercise went a little bit haywire as I got busy with my work, and in the year 2004, the pain got extremely bad and my right little toe got paralyzed. So I couldn't move my little toe and I couldn't move my feet well on the right side. And that was a very terrible time. Dr. 𝐁𝐽𝐻 at that time came to see me in the hospital, and he suggested that we've tried the conservative mean for some time now. I think it's time to look to surgery because you had a neurological deficit and it would not be wise to conserve. And since I had seen him for years and he was my senior, I took his advice, got an MRI done, and he did a conventional discectomy on my right L5-S1 disc. After that, it's been almost 21 years. I am regularly maintaining my exercises, trying to remain fit. The important thing about spine to remember is that surgery gets you out of the woods, but you have to be constantly working on your back. And I would like to thank the 𝑣𝐸ZPine people, the entire group whom I know well since more than 30 years, that they have been seeing me regularly, advising me lifestyle changes after surgery, and keeping me away from another surgery. I would like to thank Dr. 𝐁𝐽𝐻 for a great job done. So now I can stand for hours, I can sit for hours, I can do what I want, I can bend, I can swim, I can run, I can turn. The key is never get scared of your problems. Do seek attention, do not avoid seeing a doctor, because at times delaying the diagnosis can be a problem and you might end up with bigger issues, then that can be solved much easier.